All right, what are the top 5 symptoms of adenomyosis? Now, adenomyosis, if you're wondering, is endometrial tissue that goes within the uterine muscle, like it's embedded in your uterus wall, right? Now, this is different than endometriosis. Endometriosis is that, endometrial tissue that kind of migrates to other areas of the body where it doesn't really belong, right? It can be found on your ovaries or fallopian tubes, near your bladder or bowels. It can migrate to other internal muscle tissue, things like that. Clinically, gals that I've worked with that have had a type of endometrial surgery to remove that endometrial tissue, the endometriosis, it's very, very painful, but it can be found in a lot of different places. So again, sometimes if you look something up, and you're like, oh, it says that it's only found here. Well, clinically, I can tell you, I've heard from a lot of different women that it is found in all places of the body. So that is endometriosis, but adenomyosis, it is really located to the uterus. To the uterus. This can actually cause your uterus to be bigger in size than it normally would be. That's painful, right? So I'm Dr. Bethwestie, women's health and hormone expert. I'm also licensed in acupuncture, Chinese medicine, and I'm a functional medicine practitioner. I'm the author of the books, The Female Fat Solution and The Female Menopause Solution. These are on Amazon where you can pick them up. You can also subscribe to my YouTube channel, which is just Dr. Bethwestie. Stay updated on all the info I have coming out, as well as subscribe to my podcast, The Female Health Solution. You can also follow me on social media because that's also a great way to get in touch with me. So here we go, adenomyosis, top 5 symptoms. Now, your symptoms can be similar to this, but you also may have other things that pop up. And I'm gonna talk about some things as well that clinically I hear from a lot of gals. The first one I'm gonna put down is pain. Pain. The pain with your cycles. Extreme pain, excruciating pain. Pain that makes you vomit, pain that incapacitates you for the day, a lot of pain, right? And it happens on a regular basis, and you can have more pain during certain times of your cycle because it's embedded in the uterine wall. The size and shape of the size of your uterus can shift and change because of the blood volume held within it. So remember that you might notice, oh, at certain weeks it's not as bad, other weeks it's way worse. Yup. But pain overall, especially when you have your period, when the uterine lining sheds, it can be really, really, really bad. So pain, like related to your cycle. A lot of pain. I want to emphasize how much pain here, okay? Second thing, I'm going to put pain, but it's also pain with other things. You can have pain with activities. This can be, a heavy weightlifting session or intense exercise or something like that. If it's at a certain time of the month that you're doing exercise, it doesn't even have to be that intense of exercise. It can be painful. You can have pain with sexual intercourse. You can have pain when your bladder is too full. You can have pain if your bowels are disrupted, right? Because there's pressure internally that puts any type of pressure. In fact, putting pressure on your abdomen, like if you were to push down on your lower abdomen and you have a lot of pain there, that's an indicator that you potentially would have adenomyosis, because that's not normal. You should be able to push on your belly and not have pain. That's a big indicator. So keep this stuff in mind, that again, when you're trying to get a diagnosis or you're trying to get to the bottom of your problems, you have to look at all the things that are encompassing, and don't ignore some of these things just because you're like, oh, I've had this for a long time, or, oh, of course, if you poke really hard, it's not going to be comfortable. Yeah, there's a difference between not comfortable and pain. And the women that I've worked with that have adenomyosis have a very unusual perception of pain. I just heard, and I know you've heard these stories before, but I just heard this from somebody else where she actually had her appendix rupture and didn't do anything about it until the next day because she thought it was fine. She was like, that pain wasn't actually that bad. Your appendix, right? Until she got really sick and got a fever and was like, okay, something's really wrong. Yeah. Her appendix. Oh my God, that's excruciatingly painful. But to her, it wasn't that bad because it didn't touch the pain that she had with her adenomyosis. Yeah. So there is that pain and pain. You can also have heavy cycles. This goes along because adenomyosis is driven by excess estrogen. So this will go along with that excess estrogen issue. Having heavier cycles, they can be heavy for a day or two, or they can be heavy for a longer period of time. The next one is you can have clots. Again, this is an estrogen driven issue. Excess estrogen, estrogen dominance, as some people call it. So again, looking at how you work with this, it would be looking at why your body has excess estrogen and why your body can't balance it out, right? We look at that stuff through a Dutch test, seeing exactly what your estrogen pathways are so we can target them and help your system flush out that excess estrogen, balancing it better overall. So that's how we can help your system function better. When you function better, you can feel a lot better. So there's that. That one's clots. And then another one here that they put down oftentimes is fertility issues. But here's the thing. When we talk about fertility issues, they talk about it like, oh, you just have a hard time getting pregnant, staying pregnant, things like that. This is one of the top 5 things that they look at for adenomyosis. But what if you're not trying to have a baby? What if you're like, yeah, that's not on my list of things right now. I just don't feel good. How do I help myself with that? Oftentimes, if you don't list this as an issue, they won't count it. That's why we look at your Dutch test. That's why we look at your hormone test, because to us, it doesn't matter if you're really trying to have a baby or not. I mean, if you do have fertility issues, then absolutely seeing what your hormones are doing is very, very helpful. Yes. But this doesn't mean that that's one of the only factors, right? So I look at this instead of just fertility issues, cycle irregularity. If you don't have a regular cycle, it really indicates that there's a hormone imbalance going on overall. So that's why we target, again, looking at your hormones. When we see what your hormones are doing through a urine test, there's nothing that's not seen, right? We uncover everything that's correlated. So if you're looking to dive into your hormones more, really look at the origin of what's going on with your adenomyosis, go below this video, click the link, learn more about the Dutch test, and I can't wait to see your results, because this is one of the most eye-opening things when we get to see what your hormone test is doing.